Good morning, good afternoon, good evening, class, whatever time you're reading this or watching. This week we were tasked to choose an evidence-based practice model and talk about it. We're going to break it down a little bit, and we can talk about how it can be useful in our practice. Evidence-based practice, or EBP models, these serve as organizing guides to incorporating the most current research into our practice. So when talking about EBP, essentially what we're looking for is a way that we can make changes in or around our organizations and our unit that have been proven through research to be effective. And there are several models to choose from as listed in the assignment, and for good reason. That's because no size fits all, right? So much in the same, no EBP model can meet the needs of every organization, as cited by the Galveston College Library. Just as every single patient doesn't take Coumadin, right? There's Xarelto, there's loads of others. Different strokes for different folks. So I'm choosing to talk about the Stetler Model of Evidence-Based Practice. And according to the Galveston Library, this model enables practitioners to assess how to research findings and other bits of evidence that are implemented into our clinical practice. So in Stetler's model, what they do is there's 5 steps or phases. And phase 1 is preparation or identifying our need or our purpose for change. Is there an issue with pain, wounds? Is there issues with our rounding practices, etc.? What is the problem area or practice that needs to be changed? So we need to have a clear definition in our preparation. Phase 2 is validation, or making sure that the research is quality. So we're looking through research and sources and vetting them out, and then we determine whether our sources are a good fit for this. Phase 3 is called comparative evaluation, or the decision-making stage. And so in other words, of the evidence that we find, is there something there that we find feasibly able to apply to our practice? When I say feasibly, is there a large financial burden? If there's a product change, is this a quality product versus the investment? Does that weigh out? And then phase 4 is the translation application phase, where this is where we figure out how we can implement this change in the practice and what those implications might be. And then the final phase, phase 5, is evaluation, which is essentially, did we get the results that we wanted with this product or this change in practice? Are the outcomes there? Was the product worth the investment for continued use, or do we need to look at something else? And then according to, again, this Galveston College Library, I really like this source for Stetler. This model was originally created to, quote, encourage critical thinking about the integration of research findings. So by laying out the evidence in this way, there's less chance for human error and allows us the best evidence into practice. The Stetler model is also structured for single practitioner use, yet it can be a group effort if needed. And recently in a leadership meeting I was in, we discussed new heel protection boots. And so the feedback was that the heel boots we were currently using were starting to cause some pressure injuries, and that's exactly what the heel boots are trying to prevent. So using the Stetler model, if hypothetically, we could say in phase 1, we could say that there's a concern that these boots are causing pressure injuries, and we're going to get our preparation together based around that. Phase 2, we're going to look at the research around the model and the models that we could potentially replace them with. And then in phase 3, we'll look at the replacement boot and any other potential options to outweigh efficacy versus efficiency. Is the investment there? Is it worth the investment? And then phase 4, we would implement the product, and then in phase 5, evaluate its progress. So basically the questions we ask is the new heel boot doing what we think it should be doing? And are our heel injuries decreasing? Is our product effective, and was it worth the investment? So in conclusion, the Stetler model digs into how we can use evidence to generate formal change within organizations, as well as how individual nurses and physicians can use research on an informal basis as part of critical thinking and reflective use. This was per a gentleman named Ara Singh. And he says the phases are designed to mitigate those human errors and promote easy decision making, which is something I think we could all agree on. At least I know that's where I'm trying to live. I'm always looking for the way to have the best impact and with the least amount of error, cost effective. And so thanks for reading. Looking forward to reading yours and watching your videos. Thanks. Bye.